Whenever you come into hospital for your stoma forming surgery, you will meet a wide range of people, and a lot of the times everybody just merges into one and you can't really distinguish who's who. So this is just a little synopsis of who you might meet and what their role is. If you are booked in for an operation, the first nurse that you will meet would be a pre-assessment nurse, and she or he will be the person that will take all your details and go through all your past medical history. They will arrange for any pre-assessment appointments, other appointments that you might need for perhaps chest x-rays or lung function tests or stress tests if you are that little bit elderly and maybe infirm, and the anaesthetist would just like to know if you are fit for surgery in the first place. So he or she then will fill in all your documentation, and your surgeon will work with them and provide a date for your operation. Whenever you're admitted into hospital, you know that there's a wide range of nurses on the ward. So that would be the ward sister and the deputy sister, and then lots of nurses then. And nobody expects you to remember their name because everybody is in the same uniform and everybody just blends into one. There are some other healthcare professionals that work alongside the nurses on the ward. And one of the first people that you will meet after your operation will be the physiotherapist. And they will be there to help you take big deep breaths after your surgery, and also to encourage you to get up and out of bed, because it's so important to keep mobilising. And it might be the very last thing that you want to do, but it's so important to prevent DVTs and chest infections, and also to encourage really good recovery from your surgery. The dietitian is somebody else that you may or may not meet. In some units, the dietitian will always see new patients who have an ileostomy because their diet is reduced and restricted for the first 6 or 8 weeks. But if you are coming in very unwell and have lost weight, he or she will be there to encourage you to have a more higher calorific intake of your food, and they will be there really just to encourage you to ensure that you're eating a good diet. The pharmacist will be somebody that will come around the ward and make sure that the medications that you are on are tablets and drugs that you need to be on, and they will also be able to maybe provide modifications if you have a new stoma and there is a risk that perhaps that tablet won't be absorbed the same way whenever you have a stoma. So it's really important that you speak to the pharmacist and that they will be able to discuss your medication needs. If you've been diagnosed with cancer, there will perhaps be a Macmillan nurse or a colorectal nurse specialist who specialises in cancer patients, and they will be there to explain further treatment, perhaps chemotherapy or radiotherapy. They will be there to support you emotionally through the diagnosis, and also to signpost you through to different people who can help support you as well. And they will have lots of written information that will provide some more meaning to the procedures that you're going through. If you need some help on discharge, the social worker will be there to help arrange some care at home, and they're attached usually to every ward, and there's usually a social worker dedicated to a group of people, and then they can liaise then with the community team to ensure that you have a very coordinated discharge home.